Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. I'm going to tell you something that might surprise you coming from an endocrinologist, a doctor who has spent her entire career studying hormones. The term hormone imbalance makes me cringe every single time I hear it. Not because hormones aren't important, they absolutely are, but because hormone imbalance as a diagnosis tells me absolutely nothing. It's the medical equivalent of someone telling you your car isn't working right. Okay, is it the engine, the battery, the flat tire? The answer matters enormously because the fix is completely different depending on what's actually wrong. And yet women are being diagnosed with hormone imbalance every day, told their hormones are off, sold supplements to fix it, sent home without a real answer, without a real diagnosis, and often without any of the actual testing that could tell them what's really going on. Today, we're going to break down what that term actually means, and more importantly, what it's being used to cover up. I'm Dr. Thangudu, and this is Endocrine Matters. Let's start with the most basic fact. Hormone imbalance is not a recognized medical diagnosis. It does not exist in our ICD-10, which is the standard coding system that physicians use to document every diagnosis we make. Hypothyroidism has a code, PCOS has a code, Addison's disease has a code, menopause has a code. Hormone imbalance does not, because it is not a diagnosis. It is a description, and a vague one at that. Now, why does that matter? Because a real diagnosis tells you what is wrong, which hormone is affected, in which direction, by how much, and why. That information determines your treatment, and without it, you're essentially being told your car isn't working right and handed a bottle of supplements. The human body has dozens of hormones: thyroid hormone, cortisol, aldosterone, estrogen, progesterone, testosterone, insulin, glucagon, parathyroid hormone, growth hormone, prolactin. The list goes on. Each of them does something entirely different. Each of them has a completely different set of symptoms when it's too high or too low, and each of them requires completely different testing, different interpretation, and different treatment. Saying someone has a hormone imbalance is like a cardiologist telling a patient they have a heart problem. Technically accurate in the broadest possible sense, and completely useless as a clinical statement. What women are actually experiencing when they get this label usually has a real name. It may be hypothyroidism or underactive thyroid. It may be PCOS, polycystic ovary syndrome, which involves insulin resistance, androgen excess, and disrupted ovulation. It might be perimenopause, the hormonal transition that can begin years before the final menstrual period and cause a cascade of real significant symptoms. It might be actual menopause. It might be elevated prolactin or adrenal insufficiency. These are real diagnoses. They require real workup, and they deserve real treatment, not a supplement protocol. Let me give you a quick sense of just how different these hormones are, because I think it really drives home why lumping them all under one vague umbrella is such a disservice. Thyroid hormone controls your metabolism, your energy, your heart rate, your body temperature, your mood, your weight, your bowel function, your hair, your skin. When it's low, you feel exhausted, cold, foggy, constipated, and depressed. When it's high, you feel anxious, hot, your heart races, you lose weight without trying, and you can't sleep. Two very different pictures, very different tests, very different treatments. Cortisol is your stress hormone produced by the adrenal glands. It regulates your blood pressure, your immune response, your blood sugar, and your body's ability to handle physical and emotional stress. When it is chronically too high, as in Cushing syndrome, you gain weight in specific patterns, your skin bruises easily, you develop high blood pressure, blood sugar problems, and bone loss. When it is too late, as in adrenal insufficiency, you can become dangerously, life-threateningly ill. Insulin is a hormone too, one that most people don't think of in that way. It is produced by the pancreas and regulates blood sugar. When the body stops responding to insulin properly, that's insulin resistance, a core feature of type 2 diabetes and PCOS. Glucagon is its counterpart, signaling the liver to release sugar when the blood sugar drops. These two hormones are in constant conversation. Estrogen and progesterone govern the menstrual cycle, fertility, bone density, cardiovascular health, brain function, and mood. Their fluctuations during perimenopause can cause hot flashes, irregular periods, sleep disruption, mood changes, brain fog, and more. Testosterone, yes, women have it too, and it matters for libido, muscle mass, energy, many things. Each of these systems has its own physiology, its own lab tests, its own reference ranges, and its own evidence-based treatments. They cannot be captured by the phrase, "your hormones are off." I want to spend some time on a specific example of how vague hormonal language harms patients, and that's the concept of adrenal fatigue. Adrenal fatigue is not a recognized medical diagnosis. It does not appear in any peer-reviewed endocrinology literature as a legitimate clinical entity. It is a term used in some alternative medicine circles to describe a collection of nonspecific symptoms: fatigue, brain fog, difficulty getting up in the morning, feeling overwhelmed, craving salty foods. And I want to be clear, those symptoms are real. The people experiencing them are not making it up. But adrenal fatigue is not what's causing them. Here's the problem with that term. It takes a real, serious medical condition, adrenal insufficiency, and creates a softer, vaguer cousin that can be applied to almost anyone who feels tired, and then it sells them supplements. Adrenal insufficiency, the actual diagnosis, is a well-defined endocrine disorder where the adrenal glands fail to produce adequate cortisol. It can be primary, meaning the adrenal glands themselves are damaged. That's Addison's disease. Or it can be secondary, caused by a pituitary pathology. Or it can be triggered by long-term steroid use. People with true adrenal insufficiency are genuinely profoundly ill. They experience severe fatigue, nausea, weight loss, low blood pressure. In primary adrenal insufficiency, they often develop a characteristic darkening of the skin. If it goes untreated and they face a physical stressor, an infection, a surgery, an injury, they can go into adrenal crisis. That is a medical emergency that can be fatal. Adrenal insufficiency is diagnosed with objective laboratory testing. We do something called ACTH stimulation testing. There is a clear biochemical picture. It is not diagnosed by a questionnaire or a symptom checklist. Could some people with chronic fatigue have subtle HPA axis dysregulation, meaning the communication between the brain and the adrenal glands is slightly off? Some research suggests so, particularly in conditions like chronic fatigue syndrome. But that is not the same as adrenal fatigue, and it does not validate selling someone an adrenal support supplement protocol. And here is the part that I find genuinely alarming, and that I really want everyone listening to hear. Many adrenal support supplements on the market contain dried animal adrenal gland tissue, often bovine, meaning from cows. And that tissue contains actual adrenal hormones, including cortisol. When you take a supplement that contains real cortisol, even in small amounts, your brain detects it. Your pituitary gland, which normally sends a signal to your adrenal glands to produce cortisol, sees that cortisol is already present and thinks, okay, we're covered. We don't have to produce any more cortisol. Over time, with repeated exposure, your own adrenal glands essentially get taken off the job. They stop producing cortisol on their own because the supplement has been doing it for them. Now think about what happens if you suddenly stop taking that supplement. Your adrenal glands have been dormant. They don't just snap back into full function overnight. You are left without adequate cortisol, not because anything was wrong with your adrenal glands to begin with, but because the supplement caused the problem. That is called iatrogenic adrenal insufficiency, meaning the treatment created the disease. The supplement designed and marketed to support your adrenal glands can cause actual adrenal insufficiency, the very condition it claims to prevent. This is not a theoretical risk. This is real physiology. It is the same reason we taper patients off prescription steroids carefully rather than stopping them abruptly, because the body needs time to restart its own cortisol production. An unregulated supplement doing the same thing to your hormonal system without any medical supervision is dangerous, and the people selling it are not telling you this. If you've been told you have adrenal fatigue, please see a real endocrinologist, not to dismiss your symptoms, but to actually evaluate whether you have adrenal insufficiency or another diagnosable condition that can be properly treated, and to make sure a supplement hasn't already caused one. Now I want to talk about a pattern I see that genuinely concerns me. Someone comes in feeling exhausted, having irregular periods, struggling with weight, not sleeping well, real symptoms that deserve a real evaluation, and instead of getting that evaluation, they get a Dutch test, dried urine test for comprehensive hormones, a long list of results with unfamiliar terms, and a supplement protocol. Sometimes that supplement protocol comes with a price tag. Sometimes the person ordering that test is also selling the supplements. The Dutch test is not a standard validated clinical tool for diagnosing endocrine disorders. It is not what endocrinologists use. It measures urinary hormone metabolites, and while it has some research applications, it has not been validated for clinical diagnosis the way that our assays in the serum and urine have been. Results can be influenced by hydration, diet, timing, and a dozen other variables. Using it as the basis for a diagnosis of hormone imbalance and then selling the patient a supplement stack, that is not patient-centered care. That is a revenue model. And here's what I want you to understand about those thyroid support supplements you see everywhere. Many of them contain significant amounts of iodine or kelp, but some contain actual thyroid hormone precursors or poorly regulated herbal compounds that can have real physiological effects. And iodine can too. These are not harmless. They are being marketed as natural and safe, and they are being sold to women who are symptomatic, who feel unheard by their doctors, and who are looking for answers. Honestly, I understand why women end up in these spaces. I really do. The traditional healthcare system has failed a lot of patients. 5-minute appointments, doctors who are drowning in paperwork and prior authorizations, women whose symptoms have been dismissed for years, told they're just stressed or anxious or need to sleep more. That's a real failure. And when you feel that unheard, of course you go looking somewhere else. But here's the thing, and I say this with genuine care for every woman who's gone down that road. Trading a system that ignores you for one that overdiagnoses you and sells you things isn't a better deal. It's a different kind of being failed. We all deserve to break up with the bad boyfriend, the healthcare system that doesn't see us. But the replacement that love bombs you with the diagnosis, fills your head with fear about your hormones, and then profits from that fear, that's not care either. You deserve better than both. So what should you actually ask for if you're experiencing symptoms you think might be hormonal? Start with a real history and physical with a physician who takes time to listen. Your symptoms, all of them, their timing, what makes them better or worse, are genuinely diagnostic. A good endocrinologist or internist can often narrow the field considerably before a single lab is ordered. From there, actual targeted testing depends on your symptoms. Fatigue, weight gain, cold intolerance, constipation, hair loss, that points toward thyroid. Irregular periods, excess hair growth, weight gain, difficulty conceiving, you need a workup for PCOS. Hot flashes, sleep disruption, irregular cycles in your 40s, your doctor needs to be thinking about perimenopause, and so do you. Profound fatigue, low blood pressure, skin changes, salt craving, maybe you need to talk to your doctor about an adrenal workup. These are real tests with validated reference ranges interpreted in a clinical context. What you should not walk away with is a vague label, a supplement bag, and a follow-up appointment to buy more supplements. If that's what you're being offered, you have not received a diagnosis. You've been sold a product. Women's symptoms have been dismissed and minimized in medicine for a very long time. I know that. And the appeal of a practitioner who finally says, yes, something is wrong, and here's the answer. I understand it completely, but the answer has to be real. It has to be specific. It has to be grounded in the actual physiology of the actual hormone that is actually affected in your actual body. Hormone imbalance is a catchy phrase. It is not a diagnosis. You deserve a real diagnosis. If this episode resonated with you, share it with someone who has been handed this label without a real explanation. And if you want to dig into any of the specific conditions I mentioned today, thyroid disease, PCOS, perimenopause, adrenal insufficiency, we're going to keep going deeper on all of them here on Endocrine Matters. I'm Dr. Thangudu. Thanks for listening.